Well, welcome back. And we told you about the conversation we wanted to have, and we decided to do some investigation. Some doctors and nurses at the Tamale Teaching Hospital in the Northern Region, they're caught extorting monies from patients despite free healthcare services that undertaken under the National Health Insurance scheme. And our own Kwetenate and Hashmi Mohammed, in an explosive investigative documentary, they filmed health officials and the hospital demanding that patients sometimes paid for the health services that will be given to them. Their targets were mainly relatives of expectant and nursing mothers who are covered under the government's free maternal health care scheme. Just come to think of it. An expectant father, for example, said doctors demanded that he paid some 108 Ghana cedis just to cover drugs meant to induce labor for his wife, who was helpless at the time. Now, let's bring you a excerpt of this documentary. When we come back, we'll be speaking to the public relations boss of the Tamale Teaching Hospital. Stay with us.
While hanging out on the corridors of the OBS and Ghani department, I meet this lady. I've decided to call her Zina. Her sister was detained at the maternity ward. The midwife who delivered her of her baby is demanding money for assisting her during the delivery. This midwife is popularly called Auntie B. She had closed for her nightly duties, but waiting on Zina to pay 30 cedis delivery fee. This is the second time I'm accompanying such distressed patients to pay on their behalf.
My brother and sister, not say we say also to ask okay.
Such monies are not sanctioned by the authorities of the Tamale Teaching Hospital. Dr. David Akombela is the chief executive of the hospital.
Yeah, the question of extortions by health personnel from our clients, I've been hearing such complaints on radio and but nobody has concretely brought a report to me on any concrete person taking money from a particular client. But we have taken steps. We've actually written out to notify all staff that it's illegal for anybody to take monies from anybody through any unapproved channel without receipts. So our staffs are aware that when they are caught in that act, they will be reprimanded heavily.
Now you just saw a excerpt of that documentary, premiering right here on the channel JoyNews. But let's speak to Dr. Ken Osei Mensah. He is the PRO for the Tamale Teaching Hospital, but he has a real profession. He's a diagnostic person, laboratories and all that. So biomedical science is some of the things that he does. And thanks for joining us, Dr. Ken Osei Mensah.
Thank you very much.
Right. And you saw excerpts of what was filmed. And we're just showing you this. Of course, we have a full documentary and all that. Are you aware of some of these ongoings? Have you been aware of some of these ongoings? Not personally, but even as an administration, as staff who work at the Tamale Teaching Hospital.
Roland, let me say a very good morning to your viewers. As a hospital, like the chief executive indicated earlier, we've had some reports in the media about some people complaining that when they come to the hospital, people take monies from them that they feel they are not supposed to pay. And so, yes, we may have had a few of it, but no concrete reportage, like a complaint has been lodged with administration. as we speak. But yes, we are aware that some things have been going on, and we haven't been relenting on trying to find measures with which we could possibly maybe deter people from doing that, or to be able to give avenues for people to complain when some of these things happen to them in the hospital. So yes, to some extent.
So what has come to your notice beyond what you've seen in the video?
We had reports that people complain that when they come to the hospital, they pay monies that they don't get receipts for. And some people feel that because of the national health insurance, when they are not supposed to pay any amount of money.
Which they are not supposed to pay for many services that are covered under the health insurance.
For services that are covered, yes. But it is not as comprehensive as we have been made to believe. For instance, when I saw this excerpt earlier, when Kwete came to the hospital, we did a dig up of what may have transpired. You would be surprised to believe that even though in this country we have a policy of a comprehensive free maternal health care under the health insurance scheme, there are some very critical obstetric drugs that are not covered under the health insurance. And I understand that this particular one that the lady was demanding monies for is misoprostol, that's cytotec. And even though we are not condoning this practice.
But that's what you're doing. You're condoning, you're saying, you seem to be approving or legitimizing the inactions of a staff.
I'm clarifying. That woman, that night, saved a woman's life with that drug.
Yeah.
And so for every midwife with
are you saying that the money was collected as payment for a drug she supplied?
Exactly.
And she supplied from the hospital dispensary?
Here is the thing. Like I'm saying, every midwife with assault carries around emergency drugs because sometimes the time it takes for you to even move from the labor ward to the pharmacy is all the time the patient needs to survive.
Quite interesting. Emergency drugs by any medical staff of a sort, of any sort. Where would that person get the medical drug from?
Here is what they do. Previously, some of these drugs were unavailable in the hospital. Like I said, I'm not sure how long this video dates back to, but previously they were not available. And so what staff did was that they had quite a stock of them because that drug stops bleeding women after labor. And if you don't have it, the woman is likely... Yes, the cytotec. And so now what we are doing is that management has created a small pharmacy inside the labor ward where some of these emergency drugs can be kept.
That's a commercial pharmacy.
It's supposed to be paid for before it's
run by the hospital.
Yes, it's not covered by the health insurance. But then when people
run by the hospital or a commercial entity?
No, it is run by the hospital. The hospital made available these emergency drugs.
So the question I'm asking you is that, let's say in instances, for example, as we have the lady taking money after doing the delivery, but you're saying that money was paid as a result of drugs that were used in the process of her delivery. Where would those drugs be coming from? Are they coming from the hospital's pharmacy that is run or that is there, or because you are qualifying or clarifying that any medical professional of a sort need to carry on herself or himself a certain emergency drug just in case the patient needs it? It's one of those.
It's a clarification of the situation that happened there, not a justification of it. We are not condoning the fact that staff should be taking monies from patients. There's a proper way to pay monies in the Tamale Teaching Hospital. But like I'm saying, this is a humanization of the situation, making it look like she extorted money from the patient. But the patient paid for a service that she got that actually saved the patient's life. And as a result, management is continuously... You see, if you've been in the Tamale Teaching Hospital before, or if anybody has lived in the Tamale Teaching Hospital before, it's a very difficult situation when you come to some parts of this country with regards to staff strength. Sometimes you have very few staff on duty, and so moving about, going to the pharmacy and coming up becomes a difficulty. So they create small systems there that they can, in one way or the other, be able to save life with it. And the word extortion is what I'm clarifying, that to extort money from somebody is, in effect, to make it look as if you took money from something for the person for doing not doing what the person was required to receive. But in this particular situation, this particular clip, the woman saved a life because had it not been that drug, we would have lost that pregnant woman.
What you're saying, in the situation you're alluding to, this scenario you're painting, that usually happens in the medical profession, in which they have emergency drugs on them. Is it pervasive in only the Tamale Teaching Hospital, or by your experiences around?
I think I cannot speak for every hospital, but a casual read on JoyNews' own social media handle when this story was first posted there, would give you a very clear indication that that is not just a Tamale Teaching Hospital. Yeah, that is not a Tamale Teaching Hospital issue. This is a nationwide issue. And as a result, we probably need to be able to augment the system in such a way that some of these emergency drugs are covered under the health insurance.
So, but so it means you're justifying what you're...
No, I'm not justifying.
So
I'm clarifying.
What we found out there, was it an honest, perhaps behavior of any health professional? The
intentions were right. The procedure or the modus operandi may not be acceptable to the system, but the eventuality is that.
So it means you're condoning an illegality.
I am not condoning.
Because I'm just going through a preamble of the Code of Ethics, and it's on the website of the Ghana Health Service for any health professional, and it says that all service personnel shall be competent, dedicated, honest, client-focused, and operate within the law of the land. So if they are operating outside the fringes of the law, that's even an infringement on the Code of Ethics of the Ghana Health Service.
Roland, I did clarify that, of course, management is looking to create a system where these situations don't happen.
You know ethics, don't you?
I do.
Okay. And if you flout ethics in any proper organization, they come with punitive sanctions.
But have we looked at the other side? If probably she had the drug, she had decided that, okay, it is against the ethics to use it. It's difficult to get it at this particular moment in time.
That's what I'm asking. Are you justifying the actions?
I am clarifying it. There's a difference. I'm saying that management is not condoning, and we are looking to take this as an opportunity for improvement, to be able to improve on the systems we have at the hospital. It is not clear-cut. The ethics are there, and we are supposed to follow it. But the systems needs to be available for people to work within the ethics. And the systems are what are being created as we speak right now.
Is that not possible? That if a patient who is not able to pay, or any guardian who brings a patient who is not able to pay for these drugs, or these emergency drugs that ideally the legal system of our country, our republic, is not able to provide, then that person could be denied.
Here's the thing. That's why I'm here this morning. Look, if you...
let me pass you. Didn't understand my question. I'm asking you, it's a very simple question. Is it not possible that anybody in a situation who cannot pay could be denied services?
At the Tamale Teaching Hospital, we don't do that. We have a very stringent social welfare system at the hospital. That's why I'm here this morning again to tell that this is not a characterization of the staff of the hospital.
Nobody is saying that. If you look at our intro, we said that we found these instances. We didn't say that staff of the Tamale Teaching Hospital.
Again, I'm saying that for emphasis, Roland. That I want the Ghanaian
people. So we've accepted that.
Yes.
We're not saying staff, and we have to make this categorical. Staff of Tamale Teaching Hospital don't engage in these acts. Some staff of the Tamale Teaching Hospital have engaged in these acts per investigations that were conducted by a lead investigator, Kwete Nate, with collaboration with our Northern Regional correspondent, Hashmin Mohammed. They started in May. They again went some few months later to corroborate the investigations. And that's why we just brought you the initial excerpts. The main documentary is right here on the channel, so don't worry about it. But again, let's have somebody streaming in onto the studio. And on Skype, we have anti-corruption campaigner Edem Senanu. Good morning to you, Mr. Senanu.
Good morning to you too, sir.
So, I don't know, did you watch the excerpt?
Yes, I did.
Okay. According to the code of the ethics of the Ghana Health Service, every personnel, any personnel operating within the service needs to be honest and also be dedicated to serving patients. Now, what you've seen, could it have any possibility of having any personnel showing some non-dedication or lack of dedication to patients along the chain? Let's say if they can't pay for drugs.
Yes, there is every opportunity for this particular kind of practice to be abused. And as you know, we define corruption as the abuse of entrusted power. So there is every reason to believe that while some may be honest and sincere in supporting patients who come in, many others will take advantage of it to milk the disadvantaged and vulnerable patients who come to the hospitals.
Now, secondly, we've had instances in which the PRO of the Tamale Teaching Hospital, Dr. Kenos Emensa, says apparently our health system doesn't provide all the efficient drugs that are needed. More so, not all the drugs that are needed for treatment, especially in maternal care, etc. And even in hours of emergency, when nobody is around to have the mass of the numbers of professionals to be around, that are always covered under the National Health Insurance Scheme. That means that the system has created this opportunity for this to be taken advantage of.
Yes, you're absolutely right. And it's a frightening thing to think that many of our brothers and sisters who need healthcare support are likely to get it when it is most needed, because the systems we've put in place do not afford them the kind of help they need in such emergencies. So there is a weakening of our health system, and one needs to make sure that the leadership are up and doing in terms of addressing these issues that you have uncovered.
I see. One of the ethical codes of the Ghana Health Service states, all service personnel shall refrain from all acts of indiscipline, and they state some others. And then they also say no service personnel shall accept any gift, favor, or hospitality from the patient or public, which might be interpreted as seeking to exert undue influence to obtain preferential consideration in the course of their duty. The excerpt you've seen, how would you categorize that?
I think that there is every reason to believe that this is a scenario where you would say that some staff are taking advantage of the gaps in the system for personal gain. It will be very difficult to completely claim that these are all very, very sincere and honest acts. It would be rather better that management addresses this issue.
And just be on the line. Let me just go to. So now, it looks like your people they flouted the ethics, the ethics in themselves of the health service. Now at the hospital, how have you established your ethics and even implemented them to the latter in relation to patients giving gifts one way or the other, or paying for services that are outside the regular services and fees or charges of the hospital?
We, as management, we realized that there is some opportunity for people to be able to abuse some of these scenarios. And so management has, first, we went into partnership with some non-governmental organizations in the north, Colored being one of them, and then League of Youth being another, and created an opportunity where people who come to the hospital have an opportunity to report to their community leaders what they went through.
When did you notice that? And then when did you start doing these things?
In April.
In April?
Yes.
We went there in May. It
yes.
means 2 months after that you failed.
The system is not airtight.
More so, several months after, when we went back to corroborate, you again failed.
Again, Roland,
the system is partnership, doesn't it?
It might not be airtight, but it has drastically, in a way, improved on the services that we deliver at the hospital, and then deter people from doing some of these things. It's not the only thing we did in the hospital. Like so, we have created client service centers where you can walk in or even make a phone call if you want to do that anonymously, and alert management to some practices that are going on in the hospispital that you think are not right. So,
but you're aware these practices go on, because you're telling me that the staff have to do it because they are needed, especially in odd hours when the services are not available.
I only clarify a particular scenario,
so
not a generalization. No, not a generalization of everything that goes on in the hospital.
So since then, and since you're clarifying all the steps that have been taken by management, how many of such cases have been reported to you by patients? Okay. More so, what number of staff have all been caught in this web that you've taken actions against?
Several. As I speak with you, a member of staff is in police custody. He was sent to court for defrauding a patient. We also realized that most often than not, it wasn't actually staff of the hospital that were involved in some of these things. If you take a little read on the internet, you realize that we've caught two, not one. Within the space of just about a month, we've caught two people impersonating staff of the hospital, pretending to be staff of the Tamale
So
Teaching
you've
Hospital.
mentioned 2 of outside people.
And then 1 staff.
1 staff.
Who is in police
so far
custody.
since April, only 1.
I'm not done.
Of your staff. Okay.
Some staff, because we are guided by some regulations in the hospital as a Ministry of Health agency, there are some disciplinary actions that can be taken against staff who are involved in some of these things.
And earlier you mentioned several, so it means that
I'm still enumerating if you allow me. And so we have senior members of staff who have been denied promotion. There were times in the hospital where I think 3 people were dismissed outrightly. We're still battling with that with Strach because they felt that we probably infringe on their human rights. So it's not as management is just reluctant to be able to clean up the system that we have there.
So far, what numbers have so far been caught in the web or have been known to have infringed on the ethics and the regulations of the hospital staff?
I'll tell you this. We received not less than 25 complaints. Out of the 25 complaints we received, some are still under investigation. Others were actually
25 complaints involving some 25 staff.
No, not involving involving situations where patients felt that they were paid for something they shouldn't have paid for.
And in such situations, how many staff members were involved?
Quite a number of them. Off the top of my head, I'm not be able to tell.
You don't seem to be on top of the number of staff.
I am on top of the number of staff because if you let me land, in some of the situations, you would realize that when we go into it, there were legitimate payments that should have been made. People come and they come with receipts, and then they feel that because they're under health insurance, they shouldn't pay for a particular service. And they complain that why are they paying for this particular service because they're under health insurance. Then when you go into it and you realize that it is a legitimate service that you should pay. For instance, with investigations, laboratory investigations, for instance, are not wholly covered under every condition. It's a bundled tariff between the condition and the type of investigation that you should do. If it goes outside of it, the patient is required to pay for it. And we had several complaints of these. We had meetings with an NHIS. We had town hall meetings with some community leaders and opinion leaders. Management is dedicated to making sure that people are not exploited when they come to the Tamale Teaching Hospital.
Are you aware that the community in which you're operating and even the communities that you serve, there are people, inhabitants in those communities who ascribe to a certain faith, Islam.
Yes.
And in Islam, it is a norm for you to whisper into the ear of the child when it's born. You're aware of that?
I'm aware.
Well, okay. Do you know some of your staff caught in a video sometimes collect money for fathers to just speak into the ear of their infants?
And that will be absolutely unacceptable. And so now that we have irrefutable evidence on caught them on video doing that, management will take it up. And those people will be sanctioned to serve a deterrent to other people. It is absolutely unacceptable. Management has not instituted anything. They've not mandated any member of staff to do that. And people should not pay to exercise their faith. And so management will not condone that. Obviously not.
Okay, so what steps would then will be taken usually if such cases come
Cases come up because we are an agency under the Ministry of Health. There are guidelines.
Tell me.
You need to set up a disciplinary committee. The person will have to appear before the disciplinary committee. And there are punishments that are ascribed for every category of offense or breach that happens in the hospital. Your promotion could be delayed. You could be summarily dismissed. You could be reduced in rank, or there are several other punishments that could be meted out to people who are caught doing some of these things.
I see. We still have not on Skype, but this time on the phone lines, anti-corruption campaigner Adam Senanu. Thanks for again joining us, but this time on phone. Mr. Senanu, are you online? Mr. Senanu?
Yes, I can hear you.
Great. So, in such scenarios, or in this situation particularly, we're told that the management of the hospital had some actions taken against staff since April when they started stringently instituting some actions against staff that flouted ethics and regulations of the hospital. In order to make it more transparent for the public also to be more aware of some of these issues, how should the hospital management communicate this to the public, but more so to those who have been affected by this as patients or guardians who have brought their patients?
Well, I think that first of all, the hospital management ought to return to its own policy, the health system policy, and show how they are adhering to it. They need to educate the public. These are the policies in place by government and by our institutions. These are the actions we are taking. And this is whom you should report to, the number you should call, the place you should go if anybody takes advantage of you. Indeed, I think that it's always important to proffer a solution. And in this case, what probably should have happened is that the staff who are so minded that they want patients to be supported could pool their resources, and management could administer this in some way such that the cost of the various drugs and etc. are aligned with the cost that government itself would have charged. So it's just like a pool, and we can tell that nobody is taking advantage of anybody within the system. So these are things that they could do, engaging and working with media to inform the public on the specific policies in place and how they are working to adhere to it.
But in order not to isolate this scenario, it looks like these situations are replicated in other hospitals across the country.
Yes, you're absolutely right.
You're
absolutely right, and that is extremely alarming. I think that this particular expose deserves some more investigation to see how far everything it is. And it's something that we'd like to hear the Minister, the Director General of Ghana Health Service, all responding to ask what they are doing to ensure that essential drugs are in place, the kind of support that Ghanaians and citizens expect are being provided, and that we are not leaving spaces that are being taken advantage for staff who are so minded to extort money from people who don't know better, who have not been educated and don't understand that this is not a regular charge or an approved charge that they are paying out.
But what action should the management of the Tamale Teaching Hospital be taking now that this video seemed to have corroborated the reports that initially were made to our lead investigator, Kwete Nati, and subsequently we had that collaboration with Hashmi Mohammed?
No, it is obvious that the management already know what action ought to take place. The person in the studio admission that, look, this is a clarification and not a justification, means that they are all clear in their minds that this is not the way to go. However, I think that what's happening is that there is a bigger issue that needs to be addressed from the top. You and your agency, your outlet, have identified it. We also engage the highest duty bearer within the team, which is the Minister or the Director General, and say, look, your actions or inactions have provided the space for these things to happen. The people at the ground put the sanctions. The system could interrogate what has transpired. The likelihood is that we will find that it is the system that is culpable and not necessarily the individual, to the extent that these drugs were not there, they are emergency drugs. So yes, they will hold some responsibility. So that kind of investigation is required so that we can identify that ACCD has happened. This is the level of responsibility and culpability of the staff members who gave out these drugs at whatever cost. We will tell whether it was rent seeking because the price differential will tell whether this was exorbitant or was there something that was made. So the investigation is good. Sanctions may be perfect, but I think that the bigger issue is what is our healthcare system coming to? What are the administrators at the highest level doing to resolve this and resolve it speedily so that we don't have many more Ghanaians dying because of our inaction?
Is it not possible somebody who can't pay won't be in a position to offer the extra for other drugs or other services could be in a dire strait or situation?
Yes, that's perfectly possible. It is why it is the system that needs to be fixed. We can investigate and get the facts so we know what is going on. But ultimately, as Ghanaians, if we want solutions, then we ought to be asking questions of leadership. Why do we have this situation where essential drugs are not available? Basic things that ought to be done are not happening. And we have a situation where the citizen is exposed to extortion simply because other things that ought to be in place are just not happening.
You seem like, well, it was wrong for the staff to be finding themselves in such a situation, but it looks like they couldn't have helped it because the system allows it.
No, I am saying that it's not good enough for the staff to be involved in this, nor is it good enough for them to have exposed themselves to this. Actually, what we'll be expecting is that staff and management of hospitals where these kind of things are happening themselves, as it were, engage the media, right from the onset and say, look, these are things that you need the ultimate duty bearer to deal with. It should not like the circumstance where somebody has to undercover investigative journalism to then highlight the day that something wrong. So they are culpable. There's no way to avoid it. And this is the kind of thing where leadership in these hospitals should have ensured that they don't get to the point where staff feel like they have to take this type of decision or action.
Well, thank you, Adam Senanu. And Adam Senanu is an anti-corruption campaigner and joining us to give us better clarification on what steps that the management or administration of the Tamale Teaching Hospital again could take, because we have this video, and following that investigation by Kwetenate with some collaboration with our Northern Regional correspondent, Hashmin Mohammed, it was found out that apparently some staff for the Tamale Teaching Hospital tended to collect money from patients before services and even some drugs are sold and subsequently administered to patients. And sometimes they have to be done in periods of emergency. And well, Dr. Ken Osemens and the PRO Tamale Teaching Hospital is right here with me. Seem to be saying that's because there seem to be, as agreed also by Mr. Senanu, that the system allows it. But you've noted this for a long time. How far reaching have you been able to let your concerns known to the Ghana Health Service about the pervasiveness of some of these practices?
The little clarification there, we are not under the Ghana Health Service. We are an agency also under the Ministry of Health, equivalent to that of the Ghana Health Service, as a teaching hospital. We've been having conversations with, for instance, I understand that all the heads of the CEOs of the teaching hospital have been having discussions with the CEO of the National Health Insurance Authority to make sure that as a review mechanism, we put some of these emergency drugs on the National Health Insurance so that patients don't have to pay. If you are saying free maternal care, it should be absolutely or completely free. There are also discussions between the National Health Insurance Authority and the teaching hospital to see how tertiary health care, which is a little bit more expensive due to the expertise and equipment involved in it, if they could review some of the prices. Because, for instance, one other emergency drug that is on the National Health Insurance, we get it from the suppliers at 6 cedis. That's oxytocin. The National Health Insurance pays 0.1 cedis. That is 10 pesos for it. So, in a place
so you're wondering who paid the difference?
You know, that's the thing. In a place like the Tamale Teaching Hospital, would it surprise you to know that in the Tamale Teaching Hospital, we have the highest deliveries across all the teaching hospitals, even though we have the lowest level of staff. Over 800 deliveries in a month. If you compare it, if you do a comparative analysis between us and other teaching hospitals, we are way above. And we have a serious deficit in staffing. And so, as much as possible, if you have 800 deliveries and each of them you're using oxytocin that costs 6 cedis, and then health insurance pays you 0.1 or 0.21.
That's a justification.
I'm not justifying. I'm
saying officially by the Tamale Teaching Hospital for some of these things that we're seeing in the video.
Oxytocin was not in the video. I'm talking about the system, reviewing the system like Mr. Sindanu was talking about. So discussions are ongoing to see how, as a tertiary healthcare facility and with our unique position where we find ourselves, if some considerations can be made in the review of some of the charges that we get.
We have Dr. Eli Atikwi, is a registrar of the Medical and Dental Council. Dr. Eli Atikwi, good morning to you.
Good morning to you, and thanks for having me.
Now, we have a situation on our hands in which an investigation undertaken by a lead investigator, Kwetenate, is indicating that staff of the Tamale Teaching Hospital apparently sometimes, if not extort or collect money either for drugs or other essential services at a time when the staff need or the patients need them in times of emergency before administering or offering those services. Is that an affront to any ethic of the medical profession in any way?
Yeah, you see, what's happening is that you have submitted some information, and I would have wished that we also listen to the other party or conduct an investigation into the allegation, and then we can competently speak to it. But generally, or applying general principles, it is unethical for a practitioner who is being paid to deliver a service to collect, money illegally until that is established that monies have been collected illegally I wouldn't be in a position to really talk about this particular subject. But again, it is against medical ethics. It is unethical for any practitioner who is receiving salary or is being paid to deliver a service to collect illegal fee. That is what I can say in general terms.
Well, we have in the studio Dr. Ken Osei-Mensah. He's a PRO for the Tamale Teaching Hospital. Yeah. He seemed to paint a certain scenario in which some essential drugs, for example, Zytotec, is not available and sometimes administered within the period of labor or childbirth. And so sometimes the medical professionals would need to have it in handy, so that when the patients need them, their relatives could pay for them. That he says is a situation that has been made pervasive because the system allows it. There's that vacuum for it. There's that vacuum.
Yeah, you see, the issue is that we're talking about institutional management, and I would have expected that the institutions will put systems in place to ensure that drugs or medications that are needed at certain times are made available either directly for the patients to pay, or they find a way of providing them. You see, because if now individuals go out there to go and collect money, or individuals go there to provide their own medications to the patients, it goes against the principles of providing healthcare in public institutions. So if the Tamale Teaching Hospital has realized that, yes, this particular medication is important, they need to use it at specific times, then the institutions should make it available. I know that there are other institutions that do same, so that at least the institution is aware that this particular medication is not available on the National Health Insurance system. However, because we need it, we have provided it at this particular place, so clients should go to either the pharmacy or wherever it is available for them to really purchase it for use. Now, in this case where individuals go out there to purchase the drugs and keep in their bags and release them for the patients as and when it's needed, then it creates a problem for the system. Assuming I go there, I work in a hospital and I go pick a medication, a particular medication at 5 cedis and sell it at 40 cedis. Another person picks it at 5 cedis and sells it at 30 cedis. I think that there are inconsistencies and that should not be allowed.
But in my mind, I'm thinking it's quite intriguing that for your outfit, the registrar, the Medical and Dental Council, for which you offer the licenses or perhaps register the professionals to go and work in such an environment, you don't do enough advocacy then, either to the Ministry of Health, the Ghana Health Service, for the situation to be improved for these professionals to to be induced or find themselves in that situation, to get induced.
The issue is that I said I wouldn't say your assertions are true. I think, first of all, let's look at the number of the people that we register and license to practice. We're talking about the medical and dental professionals. We're talking about the physician assistants. We're talking about the certified registered and death certificates. These are the only groups of individuals that are registered by the Medical and Dental Council. When we talk about the nurses and the midwives, they are also registered and licensed by the Nursing and Midwifery Council. Now, in terms of really providing a lot of advocacy, I think that the Medical and Dental Council had occasionally gone out there to educate the public, and we also really guide our professionals to make sure that they are aware of what they're supposed to do and what they are not supposed to do. So if you are a professional registered by the Medical and Dental Council and you are aware of A, B, C, D, E, and you go contrary to that, then, we really will take you on for really breaching the ethics of the profession.
Well, thank you very much. Registrar of the Medical and Dental Council, Dr. Eli Atukwi. What's your concluding comments? When will you start looking at this tape and then perhaps instituting some actions as quickly as possible?
We'll start when JoyNews and Kwete makes it available to us. I'm aware that it will be shown this evening. We'll look at the full extent of it. Then already, like I said, there are already measures in place to be able to. We just probably need to strengthen it. And then as we have irrefutable evidence from the video, we may need to set deterrents for other people not to want to engage themselves.
So actions will be taken?
The guidelines are available there. We don't need to reinvent.
What do the guidelines say?
We'll set up a disciplinary committee for people who are found culpable doing the wrong thing in the video. Then the disciplinary committee will decide or prescribe the punishment that we should be able to mete out to these people.
Well, thank you very much. Dr. Ken Osei-Mensah is a PRO for the Tamale Teaching Hospital, helping us do, what do you call it?
Clarification of the situation.
Clarification on the subject. And the subject is a focus of a video, a documentary by Kwete Nati with collaboration with Hashmin Mohammed, in which some staff of the Tamale Teaching Hospital apparently collect or extort money from patients or their guardians before offering services. It's a great concern. Well, we'll discuss this more. Also, the documentary will be premiered right here on the channel. But I also have to say good morning to you. And Barbara Edu Jemfi Ampim, you work with the Omni Bank here in Accra. You stay in Adenta. Good morning to you. But in the meantime, though, we're taking a break. When we return, we're having that conversation. We're talking to you about the referendum that's coming up, also issues of elections that will be organized within the period. And so stay with us. We'll have a great conversation coming up.